Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a changing America. I'm Jonny Coker. New Mexico has a healthcare problem. Like many other states in the country, New Mexico is experiencing a healthcare worker shortage, with the state losing over 700 primary care physicians between 2017 and 2021, according to a report from the New Mexico Healthcare Workforce Committee. So, what's driving this worrying trend, and what's being done to fix the state's healthcare landscape? Joining me to talk about these issues is Fred Nathan, founder and executive director of Think New Mexico. Fred, thanks so much for being here.
Thank you for having me, Jonny.
So first, today we're going to be talking about the healthcare worker shortage, but I just wanted, for viewers and listeners who don't know about Think New Mexico, what is it that your organization does?
So we're a public policy think tank, and we're very different than most think tanks in this realm, which tend to be, way over on the left or way over on the right. And we just believe in a state like New Mexico that's 49th or 50th in too many of these national rankings, that the focus really should be on workable solutions rather than political ideology. And consistent with that, we have a board made up of Republicans, Democrats, Independents. I think your viewers would know many of them. So for example, we have a former governor, Gary Carruthers. We have a former Republican. We have a former Democratic Attorney General, Paul Bardicki. The chair of our board is Roberta Cooper Ramo, first woman president of the American Bar Association. So it's a good group of statesmen and stateswomen who have no personal agenda. They're just statesmen and stateswomen who want to accelerate New Mexico in these issues where we're 49th or 50th, best known for getting a full day kindergarten law through the legislature, repealing the tax on groceries, and more recently, ending predatory lending.
And Fred, this year your organization is celebrating its 25th anniversary. How did Think New Mexico first identify, the state's healthcare crisis and the healthcare worker shortage, and when did y'all start addressing it as one of the issues that you're looking at?
So we started researching this about 2 years ago, and just anecdotally, we were hearing from lots of people. I speak to Rotary clubs, for example, and I sometimes ask them, what topics would you like us to address? And over, I was hearing from so many people, I can't find a doctor, or if I have a doctor, I can't get an appointment. And when we discussed it with the board, everybody at the table had a story. One of our board members, her sister was diagnosed with cancer. And the quickest the oncologist, this is in northern New Mexico, could get her sister in was 8 months. And she was like, my goodness, my sister won't be alive if we wait 8 months. So the more we delved into it and looked at the statistics, we were certain that this is a crisis that needed a comprehensive solution. I think that's what we're good at. And I should point out, you mentioned at the top of the show, and you're exactly right. We lost about 30% of our primary physicians. But one of the things I want your viewers to understand is it's not just doctors. It's also pharmacists, EMTs, nurses. So it's really across the board. And it seemed to us that it needed a lot of study, and we needed a comprehensive plan. So we issued a report with 2 years of research that came out this fall, that basically makes 10 big recommendations of things that our policymakers can do. And I wanted to also stress that the legislature is focused on this issue, and they have taken some steps. In many cases, we want them to build on things they've already done and go even further.
And Fred, you mentioned that policy report that came out this last fall, and I wanted to pull a quote from there. Quote, looking ahead, New Mexico has the oldest physician workforce in the nation, with over 39% of doctors age 60 or over are expected to retire by 2030. As a result, New Mexicans' physician shortage is projected to more than double between 2020 and 2030, when it's expected to be the second worst in the nation, according to a 2020 analysis by researchers from the Cleveland Clinic, University of California, and Herschel Williams VA Medical Center. So my question to you is, how did New Mexico get to this point?
Well, it's a great quote, and it really goes to demographics. So we have an aging medical population of doctors and so forth. We also have a very poor, low income, and unhealthy population, if you will. And this is just demographics. As people get older, they need more medical services. And unfortunately, both patients and our doctors are aging faster than, we have more people who are elderly. So it's going to get worse if we don't take some government actions to attract and retain healthcare workers.
Mm. And so of those 10 policy recommendations laid out in the report, what do you feel like is most important to be addressed the soonest for New Mexicans and for our healthcare worker shortage?
Yeah, of those 10, I would say there's 3 or 4 that could really have an immediate impact. So first is when you talk to doctors, they talk about Medicaid reimbursement rates being very low in New Mexico relative to the rest of the country. Part of that, again, is that we have a low income population. So for example, 42% of our population is on Medicaid. By contrast, I think the national number is closer to 25%. And the Medicaid reimbursement rates don't fully compensate doctors and hospitals for the cost of care. They're losing money every time they do that. So we don't want to raise taxes. We don't want to cut other essential programs. So we thought, an obvious thing to do is to create a healthcare permanent fund using some of the one-time oil and gas money that's coming into the state right now. And the legislature, to their credit, has been creating permanent funds for things like higher education and the environment in the last 2 years. Healthcare is our second biggest expense. And the thing to understand about healthcare spending is that the healthcare inflation rates like this, government revenues are like this. They don't grow as fast. Healthcare inflation about 7%. If you go back 50 years, average government revenue increases by about 3%. So you need some additional funding. Otherwise, you're going to have to raise taxes or cut spending every year. So we said, take some of that money that's coming in from oil and gas, set up like $1 billion or $2 billion fund, which we can do with the surplus, and use that to offset some of our Medicaid expenses. And by the way, Medicaid expenses are matched 3 to 1 by the federal government. So you get an immediate return on your investment with those dollars. So that's one thing that could make an immediate impact. A second area are these interstate compacts for healthcare workers. There's about 10 of them. New Mexico only belongs to one of the 10. And these are like driver's licenses for healthcare providers that allows them to work in multiple states. By contrast, our neighboring states, like Colorado's in all 10, Utah's in 9, Oklahoma's in 8, Arizona's in 6, and Texas is in 5. We're one of only 5 states that's in 2 or less of these compacts. That's another thing that we could do immediately that would help people get access to healthcare. I'll give one quick example of how this has worked against us in New Mexico. There was a couple in Santa Fe who had a child who got some rare and aggressive form of cancer. They took their child to UNM Hospital. UNM Hospital, which has a lot of great doctors, had never seen a case like this. And they said, you really should get a second opinion. So they found doctors in Michigan and Pennsylvania who knew a lot about this disease. They called them, and the doctor said, well, your state isn't part of this compact. We can't really advise you unless you're here in person. Otherwise, we'd be practicing without a license in New Mexico. The doctors at UNM said, don't take your child to an airport because he's getting chemotherapy. So they ended up driving to Texas just to have a phone call with their doctors in Michigan and Pennsylvania, because Texas is in the compacts, but we're not. So that's another thing, that if we join these compacts, and it just takes the legislature to approve these compacts, 8 of the 10 have already been joined by 31 or more states. The other 2 are relatively new, and they'll be at that point soon. Now, some people in the legislature have argued, well, that would work against state sovereignty, but these other states somehow got over that issue because they, like us, have a need for more healthcare providers in their state. We should do the same. A third thing that would make us more attractive to doctors in particular is that we're one of only 2 states that taxes medical services. It's just New Mexico and Hawaii. Now, the legislature, again, did a good thing where they suspended part of those taxes. We would recommend just abolishing the tax on medical services, as 48 other states have done. Also, we have a great thing the legislature did about 7 years ago, is to create a tax credit for certain healthcare providers in rural parts of the state where the shortages are the most acute. But they left out some categories that we would suggest expanding into, like EMTs is probably the biggest shortage that we have. We're about 5,000 EMTs short across the state. And that would go a long way to making this more attractive for them and for other healthcare providers. And then the final issue, which is complicated, is we have the most liberal medical malpractice laws in the country that really, in too many cases, put a target on the backs of hospitals and doctors. And there are a lot of things that we do that really chase away doctors. And in the case of Gallup, they lost a $68 million judgment on a hernia surgery that threatens to close that hospital and drive it into bankruptcy. If that happens, that's 340 healthcare professionals that we would lose. And the 56,000 patients in Gallup that depend on that hospital would have to travel a long way if they needed medical services at a hospital, if that hospital's forced to close. And Jonny, if you want, we can go through some of these medical malpractice issues.
Certainly, and I do want to go through some of those medical malpractice issues, but I did want to bring it back just a little bit. Speaking about, using $2 million for a permanent fund for healthcare, I was wondering, the report mentioned using the severance tax permanent fund as a model. So can you just give me a quick rundown of what that would look like and how that would help New Mexico in the long run?
It's a great question. So about 50 years ago, the legislature recognized that oil and gas and other minerals were a depleting resource. And they were thinking ahead and thought, well, when that's depleted, what are we going to do for government revenues, because we're so dependent, and we've only become more dependent. Well, that started out as a $7 million fund. Fast forward today, and it's like $10 billion, and it's paid out. They take a 5% draw from it. And essentially what happens is they collect that tax revenue, then they send it over to the State Investment Council, which invests it in stocks and bonds and alternative investments like private equity and venture capital. And it's grown tremendously in the last 50 years. And now, if we didn't have that, well, it's generating about $500 million a year. So the legislature, if it didn't exist, would have to raise taxes or cut spending by $500 million a year. So we're saying this is analogous to what the legislators were thinking about a half a century ago, where healthcare costs are exploding and we need more money to attract and retain healthcare workers. And we also have a bigger cost than most states do for Medicaid patients and Medicare patients, and we need to subsidize those patients as well. So it'd be really smart to set aside some money now that we can draw on in perpetuity.
I see. So essentially just using it as an investment for a future, just like any other investment, essentially is the argument?
Yeah, to use it now and in the future by just taking 5% of the investment returns. The SIC on average with the severance tax permanent fund grows at about 8% a year. The legislature takes out 5% for current needs, but that extra 3% continues to compound, which enables them to pay for current expenses and grow the fund for future expenses.
I see. Well, Fred, I want to move on to talking about reforming the state's medical malpractice law like you were talking about. Why is it that New Mexico has some of the highest rates of medical malpractice lawsuits in the country, and how do we change that?
Yeah, it's a very attractive state for trial attorneys because, and you can see it in the numbers. Out of the 50 states, we're second highest in the number of medical malpractice cases that are brought. And another important statistic here is the insurance loss ratio, which sounds, I know, boring, but essentially what's going on right now in New Mexico is that insurance companies that provide insurance to doctors and hospitals, for every dollar they collect from doctors and hospitals, they pay out $1.83. So you can see it's not very profitable. In fact, they're losing a lot of money. We're now down to about 10 insurance companies that will provide this coverage in New Mexico. And really, it's smaller than that. Some of those companies don't provide very much. And so that's another crisis that's looming. And it comes back to these medical malpractice cases, which in some cases are exorbitant. And that scares away doctors from wanting to practice here. And as I said, in the case of Gallup, threatens to close their hospital.
And so, in terms of policy, what can immediately be done in the next legislative session? As you know, we're coming up with a long session. What does the state legislature, in your opinion, need to do to address these urgent issues in a way that can help New Mexicans in the long run?
Well, the way the system should work is first make the patients whole who have been harmed by medical malpractice, and then make sure that the attorneys are getting reasonable, not excessive fees, and that we're not chasing away doctors from wanting to practice here or shutting down hospitals. So one example is we have the lowest standard for punitive damages in the country. The legal standard now is by a preponderance of the evidence. So if a jury's 51% sure that punitive damages, which should only be awarded in the most outrageous cases, are merited, they only have to be 51% sure. In Colorado, by contrast, it's the criminal law standard where the jury has to believe that it's beyond a reasonable doubt that those punitive damages are merited. We'd settle for something in between, which is what most states do, which is it should be by a clear and convincing standard. Now, in some states, punitive damages are banned altogether. That's another alternative. We think in those cases where it's merited, it should be, a jury should be able to have that power, but it should be done much more rarely. Another example is many states cap attorney's fees, including many progressive states like California and New York. In New Mexico, there's no cap on attorney's fees. And this works sometimes against patients because it's a zero-sum game. When you get a settlement, whatever goes to the attorney is that much less that goes to the patient. And again, we want to make sure that patients are made whole. So there's a number of these issues. Another one that's sort of inside baseball for attorneys is venue shopping. You'd probably be surprised to know that many times when malpractice cases occur, the case isn't tried where the malpractice occurred. So, for example, in some of the areas of New Mexico, like Hobbs and Carlsbad, where the juries tend to be more conservative, one technique the trial lawyers use is, let's say the malpractice resulted in death. They hire an attorney to represent the deceased in one of the more liberal areas of New Mexico, like Santa Fe or Espanola or Las Vegas, because juries tend to be much more generous there. So there's a number of things that really need to be reined in to make this system fairer to hospitals and to doctors.
Mm-hmm. And Fred, I wanted to bring it back to the legislature a little bit. I noticed in the report it also mentioned that state representatives introduced House Bill 247 to adopt the IMLC into the state law that would allow medical practitioners to practice in New Mexico if they're licensed elsewhere. But ultimately, that and other similar bills died in committee. So how confident are you that these types of bills, especially going into the long session, will be seen by the correct committees and actually make it to the floor for a vote and eventually be signed in by the governor? Like, how confident are you in this to happen?
Well, I'm very optimistic, Jonny. What's different now, and what you were referring to, just for your viewers, is the compact to make it so that doctors from other states could come into New Mexico and practice here. That compact has been joined by 41 states, but not New Mexico. And what we're going to try to do that's a little bit different that's been done in the past, and part of this is just getting these issues in front of the public and in front of the media. So interviews like this are very helpful, frankly. So that's one part of it. And we're also trying to reach out and build coalition with other people who haven't been heard. And I'll give you one example. The Department of Defense is a big proponent of these interstate compacts because they're concerned that service members and their spouses and their family aren't getting enough medical care here in New Mexico. And they're hearing from their own people about this. So we're going to get them to come up and testify, because one of the things we're so dependent on here in New Mexico that we enjoy is we have a number of federal facilities, but there are always these realignment committees where they're looking to consolidate. And in our conversations with people that work at the Department of Defense, New Mexico could be at jeopardy of losing, for example, Kirtland, if we don't start addressing some of these medical shortage issues. And we don't want the Department of Defense to pull out some of our bases and take it to states that don't have as great a medical shortage. So we need to really take care of this problem. And one of the changes in strategy is we're going to build a much, much broader coalition of advocates to come and address this issue.
Well, Fred, this will be my last question. Where do you see the state of New Mexican healthcare in the next 5 to 10 years if the state is able to push for these policy decisions the way you describe them? Where do you see the state if we're able to, if the state pushes these laws through?
Well, this is probably going to take at least a generation to fix, but the longer we wait to address it, the answer is it depends. The longer we wait to address it, the harder it is to solve. And that's why it's so urgent that we fix these problems now. But I'm optimistic. I have a staff of 7 people, and 5 are going to be working on this full time during the session. And we're going to work on it as long as it takes, since we're not going to get this all done in 1 year, but we're hopeful that maybe we could get 40 to 50% addressed in this first year, and hopefully get it all addressed within 5 years. And we think if we could implement all of these proposals that range from the things I've talked to better credentialing, quicker loan repayments and so forth, that we could become a very attractive state to doctors and other healthcare professionals, and get back into the game and attract and retain doctors at a much higher rate than we've been doing lately.
Fred Nathan is the founder and executive director of Think New Mexico. Fred, thanks so much for joining the program today.
Johnny, thank you for having me.
Of course. That's all for today's episode. Remember, you can stay up to date on the latest local news at krwg.org. For all of us here at KRWG Public Media, I'm Jonny Coker, and we'll see you next time on Fronteras, A Changing America.